I come to the floor today because Democrats out on the campaign trail continue to spin their one-size-fits-all health care plan that they call Medicare for All. The name itself is misleading. I will tell you that as a doctor who practiced medicine in Wyoming for 24 years. Even many Democrats in that first presidential debate, well, they sounded confused about their own proposal. The candidates were asked a simple question. They were asked to raise their hands if they support eliminating private health insurance. Now, that's the health insurance people get from work. And just 4 arms went up over the 2 nights. Mr. President, 5 candidates who kept their hands at their sides, the New York Times has now reported, well, they have signed on to bills in this Congress that do exactly that, that take health insurance away from people who get it from work. On one point, though, they have all raised their hands, and that was the question that was asked of all of the Democrats the one night. All 10 Democrats in round 2 of the debate endorsed taxpayer-funded health care for illegal immigrants. Every hand went up. It seems that Democrats have actually been hiding their real radical agenda. Most Americans don't realize how dramatically Medicare for All would restructure the nation's health care system. Now, that's not just me talking, Mr. President. That's according to the latest Kaiser Family Foundation poll. Well, we need to set the record straight, and I'm ready to do that right now. The fact is, Democrats have taken a hard left turn, and they want to take away your health insurance if you get it from work. The proposal abolishes private health insurance, the insurance people get from work. In its place, they would have one expensive new government-run system. Still, Democrats know most of us would rather keep our own coverage that we get from work. Even people on Medicare Advantage, the 20 million people there, they would lose it under the Democrats' proposal. The Kaiser poll confirms Americans' top concern is, of course, lowering their costs. Or as the Washington Post health column put it, people simply want to pay less for their health care. That's what we are committed to, Mr. President, here on this side of the aisle. Yet many Democrats running for president continue to promote and support this radical scheme by Senator Sanders. The Sanders legislation would take away health care insurance that people get from work for 180 million people. That's the insurance that's covered through their jobs. In addition, the 20 million people who buy their insurance, they would lose coverage as well. You also need to know, Mr. President, Democrats' proposal ends current government health care programs. Medicare for seniors will be gone. Federal employees' health insurance will be gone. TRICARE for the military will be gone. And the children's health coverage also will be gone under this Democrat health care one-size-fits-all plan. Now, Mr. President, that's confirmed by the Congressional Research Service. The Congressional Research Service recently sent me a formal legal opinion. I've requested it from them. That's a formal legal opinion stating, quote, Medicare for All would largely displace these existing federally funded health programs that I just mentioned. Medicare, federal employees' health insurance, TRICARE, children's health coverage. Largely displace these existing federally funded health programs as well as private health insurance, the insurance people get from work. And, Mr. President, I ask unanimous consent to place into the record this Congressional Research Service memorandum to me dated May 29, 2009.
Without objection.
Thank you, Mr. President. Mr. President, this report, you look at this, it just details how the bills cut off funding. The CRS memo concludes these payment prohibitions would effectively terminate all of those programs that I mentioned in their current form. Let me repeat, the Congressional Research Service finds that Medicare for All actually terminates Medicare in this country. So Democrats want to turn Medicare, that currently for 60 million seniors, they want to turn it into Medicare for none. Not Medicare for all, it will become Medicare for none. Plus, the 22 million people would lose their Medicare Advantage. Mr. President, I know many of my patients who signed up for Medicare Advantage because there are advantages to doing it. Coordinated care, working on preventive medicine. There are reasons that people sign up for Medicare Advantage. That will all be gone under the one-size-fits-all approach that the Democrats are proposing. That's not all. This report, Mr. President, says that the Sanders bill ends federal employee health insurance. Well, you have more than 8 million federal workers, their families, our retirees. They rely on this federal employee health benefits program. Plus, the Congressional Research Service says that the bill, sponsored by over 100 members who are Democrats in the House of Representatives, sponsored by a number of Democrats in this body, says the bill will abolish TRICARE, the insurance for the military. Now, more than 9 million military members, their families, and retirees rely on TRICARE for their health care. And the report says that the bill ends the Children's Health Insurance Program. 9 million of our nation's children rely on the CHIP program. Interestingly, Mr. President, Obamacare would end as well, according to the CRS report. They say it right there. After less than a decade, Democrats want to repeal and replace their failed Obama health care law with a one-size-fits-all system. And again, the Congressional Research Service says the bill bans private health insurance. 180 million people, Mr. President, get their insurance through work. So to sum up, hundreds of millions of American citizens stand to lose their insurance, and I believe that's just the start of the pain for American families. In the new system, we would all be at the mercy of Washington bureaucrats. That means we'll be paying more to wait longer for worse care. Pay more to wait longer for worse care. Democrats' massive plan is expected to cost about $32 trillion. That's trillion with a T. And that's just a 10-year price tag. Well, guess who's going to pay that mind-boggling bill? Of course, every American taxpayer. Senator Sanders admitted in the Democrat debate the other night that his proposal, he said, would raise taxes on middle-class families. His proposal will raise taxes, he said, on middle-class families. In fact, even doubling our taxes wouldn't cover the huge cost of what they're proposing. So Washington Democrats are planning to drastically cut payments to doctors, to hospitals, to nurses, to the people that are actually providing the care. And bureaucrats, of course, would then ration care, restrict care, the care that you get that you need. It would be restricted in terms of treatment as well as technology. People will lose the freedom to choose the doctor or hospital that they want. And as a doctor, I'm especially concerned about the impact on patient care. Patients could wait weeks, even months, for urgently needed treatment. Keep in mind, care delayed is often care denied. So Democrats' grand health care vision is to force you to pay more to wait longer for worse care. And as a senator and a doctor, of course, I want to improve your care, make it less costly, and you get insurance that's appropriate for you and affordable. You should be free to make your own medical decisions. That's what it's like in America. And no question, health care needs to be more affordable. And Republicans are working to lower costs without lowering standards. And to me, Mr. President, that is the big difference. But Democrats are proposing reverse. Their plan would lower your standard of care and raise your costs. So Democrats can keep campaigning hard left on health care. That's where they are headed. Now, Republicans are going to stay focused on real reforms, reforms that promote more affordable health care, cheaper prescription drugs, protections for patients with pre-existing conditions, and, of course, the end of surprise medical bills. President Trump recently took executive actions that increases price transparency to lower the cost that patients pay. So you just need to know, Mr. President, the facts about the Democrats' one-size-fits-all health care. Don't let far-left Democrats fool you. Radical Democrats want to take away your current health care. No more Medicare or private plans, just a one-size-fits-all Washington plan. Why pay more to wait longer for worse care? Instead, let's give patients the care that they need from a doctor they choose at lower costs. Mr. President, that is our goal, that is our objective. and that is what we are going to accomplish. Thank you, Mr. President. I yield the floor.